Everyone remembers a time in their life when they were really desperate and hopeless. They remember a time when a compassionate soul saved you. You may not remember their name or even their face, you may not even remember their words, but you definitely remember how they made you feel. Just like they did for you, would you want to be able to do that for somebody else? Somebody else that was very helpless and hopeless? Do something for someone that they can't do for themselves? Being a registered nurse, I've experienced many opportunities firsthand in which we can have the special opportunity to be compassionate towards other people. The purpose of this speech is basically to explain the various means by which nurses can offer compassion towards other people. The many different ways I'm going to go through is how we offer compassion to our patients' families, and our other coworkers. Okay, so one of the ways we can show compassion towards our patients is by actively listening. This is very important because, well, I'll just give you an example. One time I had a patient that basically she was not eating. She refused to eat, and she was becoming unhealthy because of that, and she wasn't able to go home because she wasn't eating. So what I did was basically active listen, and I pulled up a chair and asked some questions, open-ended questions, and really just listened to her responses. And I think that gave her some hope when she was hopeless. And the next time I came in, she was discharged. Nurses can also show compassion towards their patients by being non-judgmental. How can we do that? Judgment comes from inside the heart. So it's not necessarily the words you say, but it also has to do with your actions, the way you are standing, and even your gestures or facial expressions, everything. Also, nurses can show compassion towards their patients by having empathy. According to the Journal of Nursing Measurement, empathy is well established as the attribute most essential in understanding another person and for promoting the health of that person. It's been shown that empathy shows client satisfaction, compliance, and also less lawsuits overall, which is really important, just from a business side of things. It's really important. And then there's 4 steps that they state in order to have compassion or empathy. First, you want to identify any strong feelings that the patient is having. The next thing you want to do is you want to pause to visualize how they must be feeling. Then you want to validate that feeling to make sure that it is truly what you're thinking it is. And then finally, you want to show interest in working with the patient regarding their issues. This is important because without that part, they may not know that you actually want to be compassionate towards them and change things. Okay, so that's basically how to be compassionate towards patients. In order to be compassionate towards patients' families, you probably want to actively listen as well. We can do this, it's the same concept, but I'll give another example. I actively listened by, one time I had a patient's family member was very stressed about the patient's condition, and just by, again, pulling up a chair and listening, asking the right questions, it really helps the family to be able to decrease their stress level. It's really important, especially in a hospital situation. Nurses can also show compassion by being respectful to someone's culture. This is, again, what I just explained with nonverbal communication. Some cultures have a hard time with, they don't want someone to have eye contact, whereas other cultures do. So it depends on the person's culture. We also need to be knowledgeable about that culture. Okay, and then finally, another way that nurses can be compassionate is by being compassionate towards their coworkers. How can we do this? We can do this by actively listening again. Another example was one time I was working and I was with a new nurse, and she was very stressed out just because of the condition, because of time constraints, just like every job. And just by listening and asking a couple questions, and by even, just asking the right questions, it helps her to be able to decrease her stress level, be able to finish the day, and really affects her patients as well. And also, this is something that not a lot of people think about, but laughter is very important with showing compassion as well. According to the Journal of Primary Prevention, laughter has positive effects on our health. It also helps employees to better devise strategies to be able to deal with the stress that they're dealing with. and also laughter may help with their social support. So in conclusion, the purpose of the speech was to explain the various ways in which registered nurses have a special opportunity to show compassion towards others, which is something that God values. In Matthew 25:31 to 46, it goes into great detail about how we can, show compassion towards others and treat them, even if they can't give something back to us, we can still treat them like God treats us, loving them and being compassionate. In the nursing profession, many feel that compassion and empathy are ethereal for scientific and objective and medical application. However, one of our most objective scientists, Albert Einstein, stated that our task must be to free ourselves by widening our circle of compassion to embrace all living creatures. Thank you.